are in Pune, west of India, at Dr. Gunwan Oswal's clinic. Dr. Gunwan Oswal, he has been helping thousands of people throughout the world with his amazing miracle G therapy. Dr. Oswal, first of all, thank you so much for welcoming us in your clinic. This is an amazing place. It's like heaven.
Yes, thank you.
And it is great to see you here, also talk to you, and also see your patients and treating people from all over the world. It is amazing. I'm sure so many people are wondering, G therapy is a miraculous treatment. Can you please tell us the story when actually you find this formula, how many years ago, and throughout the years, how many people you have been treating, which countries and everything? Can you please tell us your story?
Yeah, welcome to Pune, India. And we are here in our Center for Life Sciences, Health and Medicine. We are treating children and adult patients also from almost 50 countries, right from Canada, North America, South America, whole of Middle East, Australia, New Zealand, all these countries we are helping the children with autism, cerebral palsy and different neurological disorders, degenerative brain conditions like subacute sclerosing panencephalitis, viral encephalitis and so on. And in fact, I started researching since last almost 50 years. And G therapy or this neurology medicine was first introduced in 1989-1990. And since then we have almost helped we have treated more than 20,000 patients. 20,000 children from 50 countries. And 70% of the children have shown positive response. And we have evidence base. We record all patients on videos. So we have video recordings of more than 15,000 children.
Where do you keep these videos in your clinic?
Yeah, we have archives and we have stored all those videos in our library. And G therapy medicine was started on the principles of Ayurveda, neurophysiology and modern medicine. Like in neurophysiology, how the nerve impulse is passing. So on the basis of on the concepts of Ayurveda, this medicine was developed in the form of homeopathy. Because homeopathic pills are sugar coated, so easily acceptable by the children.
Yeah.
And it is in micro doses, like nanoparticle dosage. So even if you test this medicine in the laboratory, you will find only nanoparticles. You will not see anything else. So because of high dilution, there are no side effects for this medicine. Practically no side effects. And because of the highly energy efficient nanoparticle medicine, the actions are seen in a dramatic way in a very short span of time.
Okay, I'm just quite interested, when you take this homeopathic, because they are like sugar coated and everything. So why and how it works in a very short span of time comparing to traditional medicine?
Yeah, we are treating the symptoms here. We are treating the individual here. We are not just treating the symptom. We are treating the whole body. We are treating the whole physiology which has been altered in that child with cerebral palsy or autism or neurodegenerative disorders. So we are treating that particular physiology, altered physiology, that is what we call as pathology also. So we are treating that pathology and an individual as a whole.
When you say you're treating the physiology, okay, I have a child, I bring my child to you, or I send a video because I know that you also people send you videos and everything. So
yes.
Is it first thing, you've been doing this for many years and you've been helping so many people. What is important for you, the first thing? Do you look at the video of the child to be able to understand, or how does it work?
Yeah, we look at the video and we try to understand whether the child has got any neurodeficit like motor delay, gross motor delay, fine motor delay, whether the child has got cognitive function delay. Yeah, and then whether the child is hyperactive, whether the child has got any behavioral issue, whether the child has got any eye contact or not, how the child's speech is there. So we from the video we get the first line impression. And then we also ask all the parents to send us those who cannot bring their children here, we ask them to bring or to send us the latest neurological evaluation done by their neurologist or pediatrician. So that gives us more information. And most important is EEG study, electroencephalograph. We request all the parents to take EEG because in 1 to 3% of children with neurological disorders, even though they have no clinical seizures, the EEG may show abnormalities. And those are treatable. So, are they treatable? Yes. So once you treat that EEG abnormality, the child can improve with starting those medicines also. And along with that, when we administer our medicines, the child shows far-reaching improvements. So EEG is a very important tool in my opinion, because we do MRI. MRI will show you the structural changes in the brain, which is good for the diagnosis purpose.
Yeah.
But the EEG will reveal the electrical imbalance in the brain, which is treatable in 1 to 3% of patients. So it is better to do EEG also for each and every child.
Dr. Oswal, you've been treating children and also adults. So what is the age for treatable patient? Also, on the basis of G therapy and your findings, you say that, brain actually disabilities can improve or can be improved by G therapy. But also science people, they've been looking for an answer or answers to improve brain functions, like, to be able to support Alzheimer or maybe cognitive behavior for, aging patients. So what is your answer, or is there an answer with G therapy to this?
Yes, this is a very important question, very interesting question. See, we have treated children with various types of brain disorders or developmental disabilities right from the first day after birth. And the eldest patient whom we treated with G therapy was 48 years old, and after the brain damage at the time of birth, after 48 years we started treating and the patient started improving. So in my opinion, and I am a very strong believer, that age is not a bar to improve the brain functions. Why I am saying like that? Because the scientists are also trying to find out remedies in cases of Alzheimer's and dementias.
Yes.
And Alzheimer is seen mainly after the age of 60, 65, 70, 80 years. And why the doctors are trying to find out new remedies? Because they are very much sure that brain cell functions can be revived, can be regenerated, cells can be regenerated, or brain functions can be repaired, brain functions can improve even after the age of 65, 70, 80. That's why they are trying to find out the remedy.
Yeah.
If they feel the brain function cannot be improved after the age of 60, 70, they will say no, brain functions cannot improve. So there is no point in finding out the remedies for Alzheimer patients.
Yeah.
And this is my hypothesis since last 25 years, that brain functions can improve. So, and we have documented, there is evidence in my study and in my whatever I say, that brain functions can improve even at the age of 45 years after brain damage, 50 years, and in many patients of stroke, we have seen their condition or quality of life improve with G therapy.
So you help people with stroke with G therapy as well?
Yes, we have treated some few cases of stroke patients, multi-infarct dementias, and to some extent, in some parameters, in Alzheimer's also, this medicine can be help. It can help to some extent, and because it has got no side effects, no drowsiness, nothing. This will be a good asset for patients with old age patients and their neurodeficits.
So it is a very interesting subject actually we are talking about. When you say Alzheimer or dementia, is it the same formula that you are using, or is it individual for each patient?
Yeah, our basic formulation is same, but as and when patients have some more different problems, we add medicines to that. So it can tackle those problems also. Suppose for a patient is aggressive, we can add some few more medicines to the basic formulation, and that can treat that also. If patient is hyperactive, patient has got no bladder bowel control, so we add medicines accordingly.
So actually what you're saying that G therapy actually can be used for Alzheimer?
Can be used, yes. As a supportive treatment it can be used.
Supportive.
Yes.
What about MS?
Multiple sclerosis, we have treated few patients.
Yeah.
Yes. And in neurodegenerative disorders, even if we can reduce the speed of the disease, still it is useful.
So Dr. Oswal, with G therapy, I know that I have been seeing many patients, many results, and families in your clinic from all over the world. You've been helping so many people. But when we're talking about cognitive behavior, brain improvement and everything, G therapy, apart from cerebral palsy and many other autism disabilities, what else it can be used on adults?
Treated some few patients of multiple sclerosis also, and in my opinion, even if we can reduce the progression of the disease or the speed of the disease, that is also a very big help for those patients. And G therapy has definitely, I have seen results in that context, that it can reduce the disease progression or the speed of the disease. So G therapy can be used in those conditions also. We have treated various conditions of neuropathies, diabetic neuropathy, or spinal muscle atrophy, Charcot-Marie-Tooth disease.
When you say spinal cord, can you explain more about this?
Yeah, spinal muscle atrophy is a different condition, and there we have documented with the help of nerve conduction velocity studies the regeneration of axon or the branching of axon. The amplitude of the nerve impulse has recovered after starting G therapy, and that is the objective evidence, and we have proof. I will show you some graphs tomorrow morning. He can record.
Please.
So how was the condition, nerve conduction velocity study graph before treatment, after treatment. So that is objective evidence.
So G therapy is actually you are using G therapy, to able to treat this condition through brain.
Through brain, yes. Everything is through brain only. The whole body functions through brain only. And in such conditions, possibly it helps by helping the neurotransmitters, or it acts as a nerve growth factor, which is very important in brain injuries or such conditions, and it can try to find out the new connections between the brain cells, which is also called in modern medicine as plasticity of neurons. So my medicine has definitely shown a role in plasticity of neurons.
Dr. Oswal, you're saying that G therapy is actually, when it is being used on patients, finding ways to treat any disconnection in brain. So how is that possible, and how?
Yeah, we have done in many patients with neurological disorders or the chronic neuropathies, demyelinating neuropathies. We have done the studies with nerve conduction velocity studies before G therapy and after G therapy, and there we definitely found that the velocity of the impulse has improved after G therapy. The amplitude of the nerve has improved after G therapy. Thereby it shows possibly it is acting as a nerve growth factor in patients with GB syndrome, in patients with chronic demyelinating neuropathies. So it is definitely has a evidence based, we have a study on this, and all these conditions are irreversible according to conventional medicine.
Yes.
But we have documented that with the help of NCV studies done by the same neurologist, done on the same machine, and it has shown reversal of the changes, reversal of the damage, reversal of the neuropathy. So it has got a very broad spectrum of action, and which is evidence based.
That is amazing. So what is the formula behind G therapy?
See, it is a combination of different natural medicines.
Everything is natural.
Everything is natural. Everything is natural, and based on the principles of neurophysiology. That is what I was talking just now.
Yes.
And neurophysiology and Ayurvedic principles. The concept.
There is nothing chemical at all.
No chemicals, and it is in extremely high dilution, like nanoparticle. So it is as good as a nanoparticle, and even if you test this medicine, you can see the nanoparticles inside the G therapy medicine, but no chemicals, no active substance is found. That is why it is 100% safe.
So let's a patient a month old can take G therapy, as well as a patient like 70 years old can take.
Yes, it can take. And interestingly, recently we have we are doing a research in a very lethal disease called subacute sclerosing panencephalitis. We have the largest data in the world of more than 500 patients of SSPE treated at our center, and we have evidence-based study that the EEG in these patients, about 35% of patients are showing EEG improvements or normalization of EEG in this lethal progressive neurological disease. And so far I don't think there are any proven cases in the history of medicine that EEG can be improved or normalization of EEG can take place in cases of this degenerative progressive disease of subacute sclerosing panencephalitis. And many of the patients, about 70% of patients of SSPE have shown clinical improvements. Recently I have presented my work in the International Child Neurology Congress, and my abstract is available online also. So that is a very big concrete proof that G therapy is working at a neuronal level to improve the brain functions at the neural cell level.
This is amazing.
And I appeal to medical scientists, medical researchers, brain research organizations that we have a data of more than 500 patients of subacute sclerosing panencephalitis and more than 20,000 patients of developmental disabilities. So let us come, let us do further research for the benefit of humanity. Yes.
Dr. Oswal, the formula you're using for a patient for any brain disability, is it same that the formula with SSPE or different formula?
Yeah, little variations are done as per the patient's condition.
And so we can actually see the improvement with SSPE patient.
Yes, definitely. I have published a book. It is for the first time in the world. I have published a book of 45 patients of SSPE showing their EEG before and after treatment. So that is readily available, and I have already given you that one book which you can forward to medical institutions. It is also available. That book is also available in PDF format, so we can send it to anybody. And now. Recently, that was in November 2018. Now this is July 2019, and I am going to publish a study of 100 cases of SSP with EEG improvements. I am going to publish that book.
Yeah. So, but I mean, what you are saying is, in a way, that you find the fountain of life is quite something, because through by treating brain, you can treat the whole body.
Yes.
That is quite something.
Yeah, because the whole body functions depend on the brain. So when you are treating the symptoms, you are as well as treating the brain part also. And when you are treating the brain part, the whole body functions, they also improve with that medicine.
And you also mentioned about diabetic.
Diabetic, I am talking about diabetic neuropathy.
Okay.
I am not treating diabetes.
Okay.
I am treating the neurological effects of diabetes on the nerves. And those can be helped. The progression of the diabetic neuropathy can be slowed down with this medicine. Yes.
G-therapy.
Yes.
Okay, Dr. Oswal, can you please tell us, for instance, I want to find out how G-therapy works on patients with autism.
Yeah, autism is basically all symptoms, as I told you, are related with the neurochemicals. And G-therapy, when we are treating, has action on the neurochemicals in the brain. So in patients with autism, the child's eye contact improves with medicine within 2 months. In most of the patients, the hyperactivity is reduced. Some patients have shown decrease in the hypermotility, aggressive behavior, behavioral issues with the children, and then in some children speech has developed, which is a very important thing, because in children with autism, social interaction is very less.
It is.
And the speech is affected. So this medicine has shown improvements in speech, hyperactivity, attention span, concentration, behavioral issues, aggressiveness, sleep pattern. It improves with this medicine. And we have documentation with videos.
Actually, yesterday I saw a case. There was this child. He was 6 years old. When he came to see you, he couldn't move his left hand and actually left arm altogether. Within the starting G-therapy, within 2 months, he could actually use his left arm. It was quite beautiful to see.
That we have seen in a British patient also, Laura Ziged. She is from England, and after starting G-therapy medicine, within 15 minutes she started using her left hand.
Really?
And I and Laura and her mother, Val Ziggett, we were interviewed on one of the London television channels, health channels, by me. We were interviewed. So that video is available.
Also, what I'm wondering is, we talk about Down syndrome, and how does it work with patients with cerebral palsy?
Same thing, it is helping either at the neurochemical level, neurotransmitter, synaptic levels, and it removes the blockage at synaptic levels, or it is helping at plasticity of neurons, thereby making new connections with the help of regeneration of axon, branching of axon. And in 1996, I started with a new hypothesis that there is a dormant supreme control in the brain.
Yes.
There is a dormant supreme control in the brain which, if activated, can improve the brain functions or the body functions. That was in my 1996, and I published that hypothesis in the booklet Mind, Body and G.
Yes.
And recently, about 3 years back or 4 years back, Canadian and the European scientists have found out that dormant supreme control gene.
Yes.
They have found out 16 years after my hypothesis.
Yes.
So, and that hypothesis I made it with the help of 2000 patients documentation. And they have found out this gene in experimental animals. So I feel that there is a dormant supreme control somewhere. You may call it as anything. And if you trigger that, if you activate that, it will send signals to various parts of brain to start functioning. Because the main function of the body is to regenerate the lost function, regenerate the damaged function, to make the life quality of life to improve.
Actually, I was going to ask, is it, by nature, it is our default code?
Pardon?
Is it our default code to regenerate, to carry on?
That is the natural way also. Because in so many times we see that the patient is in coma for 2 weeks, 3 weeks, 6 months, and then the patient comes out.
Yes.
Why it comes out? Because it is a regeneration inside. So, and there is a dormant supreme control which is getting stimulated, and then it sends signals to different parts of the brain to activates it and start the functioning of the different systems, different organs.
It is amazing. Also, I asked you how it is, being, helpful on Down syndrome, cerebral palsy. What about you also, talk about some stroke cases? How does it work?
Stroke patients says we have definitely seen improvement in the quality of like spasticity, improvement in speech, improvement in motor functions like
In
those.
speech and everything?
Yes. We have some videos of those patients.
Maybe we can see that.
Yes, we can share.
What kind of time span you will need? I'm sure that it is varies from one patient to another, but like in general?
In general, see, earliest improvement was seen in a patient within 15 minutes after starting the medicine. That was in a British patient. But in general, we suggest that within 2 to 3 months after starting giving medicine, in 70% of the patients, definitely improvements are seen in one or more functions of the body.